So now I'm going to show you how to apply a TENS machine, and we've got a patient here with low back pain. Prior to applying the machine and the electrodes to the patient's back, you need to get your patient's consent, as with any treatment. You need to ensure that they've got no contraindications, and you need to check their skin sensation. So this time we use a pinprick. So I've explained to my patient that I have a blunt an instrument and a sharp instrument, and I just want them to differentiate across the lumbar spine for me which I'm doing. So, okay, which one is this?
Blunt, sharp, sharp, blunt, sharp.
Okay, so you do a few tests like that to check their sensation. I'm then going to apply the electrodes, and the further apart the electrodes are, the deeper you will get the effect of the TENS machine. So I've got these self-adhesive sort of jelly electrodes here, so I'm going to put one over to the right hand side of her lumbar spine and one on the left hand side of her lumbar spine. So I've got those a good distance apart. They need to be at least an inch apart to be working. I've got my little machine here, and I'm going to, this is in channel 1, so I'm going to switch channel 1 on. I now have an option with the TENS that I can either use the high TENS or low TENS. So high TENS is a relative high frequency, which is 80 to 130 Hertz, and with a relatively narrow or short pulse duration. Which has a limited carryover after the treatment has finished. Alternatively, you can use a low TENS, which is a bit more like acupuncture, which is what I would use for someone with chronic low back pain, just making sure there that the electrodes are stuck on properly. So a low TENS would be a lower frequency. So I'm going to set this machine here that I've got at a lower frequency of approximately sort of 2 to 5 Hertz, and then I'm going to set a longer pulse length of about 200 milliseconds. Okay, so I've got it at 5 Hertz and I've got it at 200 milliseconds. Now I'm going to slowly turn it up until my patient can feel the sensation. Can you feel the sensation coming on?
Yep.
And what you tell them is that you feel a kind of comfortable pins and needles sensation. And as you've learnt from your lectures, this is working on relieving their pain by the gating the need to edit that bit out, sorry Chee-Wee. It's gating the, I can't think.
Affecting pain gate.
Yes. So this is working by affecting the pain gate mechanism. You can also use a brief intense TENS, which is a higher frequency but a longer width of pulse mode at 200 milliseconds at the patient's highest tolerance for 15 to 30 minutes. And there's also, on lots of TENS machines, a burst button, which can be used for any frequency to suddenly give them a burst of treatment. Perhaps if they're having an acute episode of pain, or perhaps when they're in during childbirth, giving birth, in labour. The low TENS setting, which is the lower frequency of the longer pulse length, has a good carryover of pain relief. So after you've treated a patient with this low TENS dosage, then you would expect them to continue benefiting from the treatment for longer than had they had the high TENS treatment. You also need to advise the patients not to wear this overnight, and you must make sure before you apply the electrodes that the skin is dry.